going to beat you to the punch.
We're looking at each other having a staring contest here. Who's going to start talking first?
I was going to go. I was going to say, like you say, it's another beautiful day in Southern California.
It is, isn't it?
On Extreme Health Radio. Can I take that spot now?
Oh, man.
I'll be the intro.
You'll be the intro. It is a beautiful day, though, isn't it?
It's gorgeous.
Today's a nice spring day here at May 2nd?
May 2nd. It's supposed to be 80-something.
80-something degrees. Amazing day here in Southern California. May 2nd, 2013. And let's see. My name is Justin, and my co-host is Kate.
Hello, everybody.
And we're broadcasting, like we said, from Southern California worldwide. Last I checked, we're in over 110 countries.
Cool.
It's amazing. And this is episode number 96. So if you want to check out the transcripts or the show notes or any books or reference materials that the doctor mentions today, you can do so at extremehealthradio.com/96. No need to take notes. And if you want to send a voicemail question in, we've got a nice little feature on our website that we're working on improving, but you can go to extremehealthradio.com/voicemail and you can record your question for us or for our guest, and we'll play it on the air. And that'll be a good little feature for you. Or you could email us, Justin at extremehealthradio.com or
Kate at extremehealthradio.com, K-A-T-E.
K-A-T-E.
Yes.
And this show is brought to you by Amazon.com. If you want to support our work and you purchase frequently from Amazon, feel free to do that. We'd greatly appreciate your support. You can go to extremehealthradio.com/Amazon and do so every time you make a purchase, and you don't have to purchase anything related to health, and we'll get a little commission every time you order from Amazon through that link. So very much appreciated. And let's see, anything else that we need to get to? Oh, I need to thank Mike Adams of Natural News Radio.
Of course.
Yeah,
Thank you, Mike Adams.
We're on his radio station, his network, naturalnewsradio.com, and nice for him to have us on his network. So thanks, Mike. And let's see what else here. Some business to attend to. Oh, I wanted to let you know about our upcoming show schedule. Let me go to our show schedule page. Lots of really great guests, cutting edge guests upcoming here. We're going to talk to Billy Best, who had cancer as a teenager and has an amazing story with being forced as a teenager to have chemotherapy and his recovery and what he's using to heal. So that should be a good show. And then we have Charles Irwin. He's going to be talking about the Constitution and states' rights and all of that kind of information. And all this stuff kind of cycles back to health too.
Yeah.
So that'll be an interesting show. And then we've got the amazing Adam Bergstrom coming up on the 16th. And he's a chronobiotic nutrition guy. You love him, don't you, Kate?
I love him. That'll be our third with Adam?
That'll be our third show with him.
Awesome.
Yeah, he's a cutting edge guy. Similar to Dr. Steven Hines, who we have on today. And
yay.
He has a clinic. He's got two websites, hopewellness.com and hopewellnesscenter.com. And he works with people with allergies, cancer, gastrointestinal issues, hormonal imbalances, lupus, fibromyalgia, chronic fatigue, Lyme disease. He's been doing a lot of work with Lyme disease. He's a naturopathic endocrinologist and master herbalist, and he's been doing this practice for 15 years. And he's in San Angelo, Texas, just over the border. He's got a clinic in Mexico, and he has, I think, where his office is in San Angelo, Texas. And so it's an honor to have Dr. Steven Hines on. Thanks a lot, Steven, for coming on.
Well, you're welcome.
And how are things today for you? Going good?
Oh, yes. We're doing wonderful. I just got a house full of cancer patients in Mexico at the moment, so it always keeps my mind busy. Got another 3 of them coming Monday, so we have probably half of our patients in Mexico are cancer, and the other half is just pretty much any kind of incurable condition, at least what's generally considered incurable. Obviously not so incurable if we are successful with them, but we do a lot of autoimmune diseases like fibromyalgia, chronic fatigue, rheumatoid arthritis. We do congestive heart failure, and then a lot of things, and nobody really knows what it is. They just feel bad. They hurt all over. And so much of that is from what we call zoonotic infections.
Wow. What is that?
The term zoonotic or zoonosis means an infection that is basically vectored by an insect. And so anything that, maybe a mosquito could bite an animal, give the animal a bacteria and it incubates in the animal. Then another mosquito or a tick bites that animal and becomes infected, and then it drops off on the grass, and you're walking along, and that tick catches a ride on your pant leg and then crawls up and bites you on the neck and injects you. So it's kind of a transfer of bacteria, protozoas, from the animal species to humans, or from one human to another, via an insect vector. And they're very difficult for doctors to diagnose because there's so many of them, and they have so many overlapping symptoms. So it's kind of a best guess.
Wow. So what did you call that again? What was the name of that?
Zoonotic, Zoonotic, or zoonosis, Zoonosis.
Wow.
I think somewhere approximately 70% of the infections in humans are of that category, versus you simply coughed up some chlamydia pneumoniae and somebody was next to you and breathed it in. That's, airborne vectored, versus the zoonotic approach, where you've heard a lot lately about people getting bit by bed bugs.
Yeah,
Right.
we've heard that.
Yeah, it's becoming an alarming thing. I mean, we just bought a camper just because we're going to minimize traveling and staying in hotels, because Hilton hotels and Sheraton's, these very high dollar fancy hotels, they've got as big a problem as your little small motels, and people are traveling all around the world, and they may have carried something in their luggage into the hotel. It gets in the bed, and next thing you know, you wake up one morning. I've had it happen to me a number of times where I got little bites on me, and I thought, what in the world is that?
Yeah, we've had that same issue.
Yeah, and I've had some people who got terribly ill,
Gosh.
near death, actually,
Really?
a couple of times from something that they got in a hotel. And unfortunately, it's very difficult to diagnose, and that's one of the things I want to talk about today, is that I am also on the board of directors of a laboratory called KS3 Diagnostic Laboratories. And KS3 Diagnostics is a new cutting-edge laboratory technology where literally you could take a specimen of someone's blood, send it to KS3 Diagnostic Labs in Lubbock, Texas, and they will DNA sequence every organism in that specimen. And categorically, I'm talking zoonotic infections here. Protozoas, Babesias, Lyme disease, leptospirosis. And you don't have to be a good doctor anymore. You just say, send them the blood, because if there might be 10 different infections in that person, and most likely that test is going to pick them all up if they're of substantial quantities. So it's a very sensitive test, and instead of saying, I want you to test me for Lyme disease, which is technically the Borrelia species of spirochetes, which is a corkscrew type bacteria like syphilis, but there's 7 or 8 different ones. So if you went to a lab, normally you'd say, I want you to test me for Borrelia burgdorferi, which is the Lyme organism.
Okay.
If they say, well, we don't find it. Well, what if it's one of the other 7 or 8? What if it's Babesia? What if it's Leptospira? What if it's Treponema denticola or Q fever? There are many, many, many more infectious agents that have the same symptoms as Lyme.
So is this looking for like the actual DNA of the Lyme disease?
It is a DNA test of extraordinary caliber.
Okay.
There's really never been anything like this. It's kind of Star Trek-ish. It's like, well, scan me, doc. Here's my blood.
Yeah.
And it sequences, we typically report anywhere from 60 to 90 different categories of zoonotic infections, whether they be protozoas or spirochetes or mycoplasmas. Now, we do find something that's kind of unique, is that we do what's called a triple shot
Okay.
And that's where you draw blood. You also do a finger stick and then maybe a big toe stick. And it's really interesting because you will not always find all of the same organisms in all three places.
Really? So it'll be different organisms in different places in the body.
Yeah, so they tend to concentrate. Like if you got bit on the nape of the neck with a spirochete that's like a Lyme bug, they grow so slowly, like one today is 2 tomorrow, and the next day there's 4 of them. It could take years for them to disseminate throughout the body. So you're going to much more likely have a higher concentration in the upper torso and the arm than you would be in the toes because you got bit up top first.
Wow, that's
versus if you got bit on the foot, there would be more concentration there initially until eventually they'll be more broad spectrum and disseminate. But it depends on the type of organism because spirochetes are like the corkscrew when you open your wine bottle. They just go anywhere they want to go. They just twist through all the tissues of the body.
Do they actually get into the cells themselves?
Oh, yes, absolutely.
Wow.
They get in brain cells, they get in the bone marrow, they get in your lungs, they get in your GI tract.
And these are called spirochetes.
Spirochetes.
Wow. And so a lot of times when people test with Lyme disease, is the test not completely accurate because they're kind of testing for symptoms and not necessarily like the DNA that you're talking about?
What they're looking for the most part, and it's still, I believe, standard of care, or what they would say the gold standard up till now, has been the Western blot test. So Western blot is basically an antibody test. So if you're producing antibodies against Borrelia burgdorferi, that true classic Lyme disease thought, well, if you had antibodies, then if you had the right lab and they got, you had, it's kind of complicated, so I'm kind of hem-hawing, but you produce an antibody and you ran the best antibody test out there, you might get a positive test.
Okay.
Unfortunately, they only test for 1 or 2 or 3 organisms total. Well, there's 7 or 8 different Borrelias, and then you have leptospiro, which is, there's 15 or so of those, and it's a totally different organism, but it causes the same symptoms. So the battery of testing, like I'm speaking of now, is a new concept to test for them all at once.
Wow.
But what if you're immune suppressed? I mean, Lyme disease is very immune suppressive, and so what if you're not able to produce an antibody? And heck, right, a lot of the people that have Lyme disease, they've been misdiagnosed as lupus or rheumatoid arthritis or fibromyalgia, chronic fatigue, ankylosing spondylitis, etc., and they're on immune suppressive drugs like dexamethasone or prednisone to keep pain down. Well, then that suppresses the antibody response. So, the very treatment they're taking inhibits them from getting a positive Western blot test. That's why we have gone to the super sensitive DNA assay, and furthering that, gone to sequencing everything in the blood at one time, not just saying, well, I want you to test for this one bug. We don't do that. Our test tests for all of it. It's just part of the package. Just the way the system is built. It'll just keep sequencing organisms until it identifies all of them.
Wow. So what do you think the role of these spirochetes are in terms of just about every disease? Because I know you talk about how they're related to autoimmune diseases, but would you imagine there's some kind of role with these spirochetes in things like cancer and heart disease and everything else as well?
Absolutely. There's actually a condition called Lyme carditis. And Lyme carditis is where the spirochete has made its way into the electrical tissue of the heart, maybe the atrioventricular node, where the pulse that keeps the heart in rhythm is, or one of the other nodes. And if it gets in there and starts causing an inflammatory process, the electrical signal may become delayed. So the heart starts beating out of rhythm, and then you end up in congestive heart failure.
Wow.
See that in Mexico, probably once or twice a year. You have most any arthralgia, rheumatoid arthritis, osteoarthritis, chronic fatigue, migraine headaches, ALS. We have an ALS patient right now who's getting better every day. I've got another one coming Monday, an ALS patient. We've actually had tremendous success with ALS patients. The problem is that when we get them, they're so far advanced that even though they're improving, obviously, gone from can get out of a wheelchair to standing and taking a few steps, and then they end up dying of pneumonia, or they get a blood clot because they've been in a wheelchair for 4 or 5 years, or they aspirate because if it hits the throat area, swallowing muscles, they easily can drown in their own sputum, and they aspirate a lot. So early enough, we've actually turned around 4 or 5 of them. I've lost that many who were getting better, but they threw a DVT, went to the lungs, or one of them was getting better, and excuse me a second, he went home for a weekend, got feeling poorly, went to the hospital, and they said he had they said, well, it's just your ALS progression, and they missed the pneumonia.
Oh, wow.
Pneumonia, although he was getting better daily from the treatment in Mexico. So,
isn't there a correlation with ALS and Alzheimer's and some of these neurological diseases with heavy metals and things? I'm sure that's all tied together, though.
I'm actually writing the book right now. It's called The Definitive Guide to Lyme Disease Diagnosis, Treatment, and Management. I'm also writing the book on fibromyalgia, and a little ebook on Alzheimer's and dementia. I have a scientific paper that I don't have it in front of me, but 87% of the dementia and Alzheimer's patients on autopsy, they were able to culture a spirochetal organism, a corkscrew type bacteria, from the brains of those people. And it may not be necessarily Lyme disease. It could be another corkscrew type bacteria that is called Treponema denticola. And Treponema denticola is common in the oral cavity. And as long as it stays in the oral cavity, there's no problem.
Okay.
When you have a root canal tooth, you've got this infection in there, or a cavitated socket, some breach of the oral cavity, then they get into the brain and the central nervous system. They will create all sorts of neurological conditions. And there was no test, at least a diagnostic test that a doctor could run, until the new test that I'm speaking of. The predecessor to it was the Spirostat test. It's been pulled from the market. We've totally rebuilt the test and made it more sensitive and cheaper. And what was Spirostat lab is now KS3 Diagnostic Laboratories.
Oh, okay.
But we actually found this Treponema denticola in 3 or 4 ALS patients. We found it in some Alzheimer's patients. Any kind of central nervous system disorder, highly suspect for dental pathogens of this nature, the corkscrew type. And if they show up in your blood and you've got central nervous system type symptoms, very good chance that that's what's causing their problem. And we've seen this at least a dozen times now in the last 4 or 5 years since we became cognitive of it. And the research is out there. It just takes forever to get into mainstream thought.
Sure.
It's like H. pylori bacteria causing stomach ulcers was known in Australia 55 years ago. It made it to the U.S. 10 years ago.
Wow.
And so, it just takes a long time. And of course, that's why we do these shows, is to help people kind of jump up there a couple, 30 or 40 years and get ahead of the curve, that if you've got an ALS symptom or multiple sclerosis symptom or Alzheimer's, dementia, Parkinson's, many of these conditions are caused by a spirochetal infection in the brain. Now, yes, your question is, do heavy metals cause those things? Yes, they surely can. But they are much less likely to cause it than a zoonotic infection.
Interesting.
So besides the mosquitoes and things carrying that, how are most people or other people getting this?
Well, I was invited to speak at a Lyme disease meeting up in Martha's Vineyard.
Ooh, nice.
I guess just near Boston.
Right.
And they, at the International Lymes and Associated Disease Conference every year, you have all these patients come who are so debilitated. I've seen 35-year-old girls walking with walkers with blankets on them, tremors and shaking, and you can't help to converse with a lot of these when you go to these meetings. They're everywhere. Wow. And I asked what happened. Well, I live out at Martha's Vineyard, and every day I would take my dog for a walk along the beach through the grass and sawgrass, and when they would come back home, they would have 100 ticks on the dog and 100 ticks on the people.
Ooh. Every
day that they took their dog for a walk. And so how can you not get Lyme disease? Like every day they're exposed to it so tremendously. And if you think about it, 150 years ago, if there was a forest fire back east, it burned 25,000 acres. Burned houses, it burned farms and fields, and the ticks were dead. There wasn't going to be a tick for many years.
Yeah.
Now everything's so quadrant off, and we got a subdivision here. We got deer in the little thicket out behind the house, and because of all the animal rights people and don't shoot the poor deer. Then I've actually seen deer that had thousands of ticks faces, and they were all emaciated and shaking and trembling because they were so infested with Lyme disease.
Oh my God.
Wow. Golly, this is just fascinating information. We're with Dr. Steven Hines, and his website is hopewellness.com and hopewellnesscenter.com, and fascinating information. And when we get back from the break, we have a couple listener questions that we're going to play for the doctor, and I hope you're enjoying the interview so far, and we'll be right back after this break. So there's no real way to avoid toxins or chemicals in our daily life. It seems like we're exposed to them no matter what we do in our lives, from paint fumes to mercury fillings, coal-fired plants, perfumes, soaps, off-gassing of carpets in our houses, and genetically modified foods, and foods that are sprayed with pesticides and herbicides, the xenoestrogens in plastics and car exhaust, secondhand smoke, even your dry cleaning and laundry detergents, even your mattresses have chemicals inside them that outgas. So getting these toxins and chemicals and poisons out of your bloodstream and out of your fat cells is going to be really critical moving forward in our society, because it seems like every year there's more and more chemicals that keep becoming introduced with new products in the market. So I would consider getting one of these far infrared saunas. We've got a great sauna developed by Phil Wilson, and I've known about his work for many, many years, and I'm so proud to be offering his sauna on our website. And he's been in this business since 1975. And this sauna is really great because it slows the aging process. It helps with weight loss and burning calories. I think you can burn like 600 calories in 15 or 20 minutes, and it helps to cleanse the skin. It improves your sleep and helps to prevent illnesses like flus and colds, as well as energizing the body. And it's great for improving blood circulation and promoting cellular renewal, as well as increasing metabolism. and inducing profuse sweating, and it's really, really great. And the great thing is too is you don't produce any lactic acid, so you can sweat without producing any of this lactic acid that you would normally produce if you lifted weights or went for a big long run. So if you're interested in this, you can check it out, extremehealthradio.com/sauna. It's great because it sets up in about 2 to 5 minutes, and it's portable, and it's super easy to clean. It's got low electromagnetic field radiation coming off of it, and it produces energy and heat inside the sauna evenly. It's great machine. So if you're interested in sweating like this for only 15 minutes a day, it's great. It requires 0 preheating. It's got a 1-year warranty, and Phil Wilson is a great guy. We're so proud to be offering his saunas on our website. So if you're interested, check it out, extremehealthradio.com/sauna, or you could check it out in our store, and it's $990 plus $25 shipping. And that's really a good deal because many of the saunas out there, you can check them out. They're in the thousands of dollars, $2,000 to $4,000. So this is great. You can buy it through PayPal. You don't even need a PayPal account. It's 100% secure. So consider doing this if you're interested in living a long, healthy, disease-free life. So check it out, extremehealthradio.com/sauna. All right, we're having a good time here with Steven Hines, naturopath in St. Angelo, Texas. And it's a fun interview, and we're learning a lot, getting a real good education about spirochetes, and we're going to learn more about autoimmune disease and cancer and digestive health. We all need help with that.
Don't we?
Oh, man. Oh, man.
Oh, man. Oh, man.
Man, oh, man. So, we're with Steven Hines, and we have a little question here that we offer for our listeners. Let me just cue up the question here. We'll just play the question right now. It looks like this one is from Christy. Okay, here we go.
Hi, Kate and Justin. This is Christy. I have a question for Dr. Hines. I am 33 years old and was diagnosed with RA about 2 years ago, and I am determined to fight this naturally, trying just about every natural treatment available. I've changed my diet. I've cut out dairy, sugar, grains, and all other foods I'm sensitive to. I've done 15 treatments of hyperbaric oxygen chamber, FSM treatments, acupuncture, massage, and acupressure massage. I was on the antibiotic protocol just until recently, and I'm currently taking LDN among other various supplements. All of these things may have slowed down the progression of my disease, but they definitely did not get me into remission. In fact, a couple months ago I had a really bad flare-up, which made me very anemic. I was almost required to have a blood transfusion, and since then my doctor put me on prednisone and Humira, which I've now been on for about 2.5 months, and my numbers are finally leveling out. My anemia numbers are almost in the normal range, and my SED rate has dropped from 100 to 27 now. This is the first time since I was diagnosed that I've actually feel like I've had a quality of life, but I prefer not to be on Humira and prednisone. So my question is there anything else I can be doing to fight this naturally and get off the traditional meds?
Okay, so Steven, what do you think about Christy's issue?
Well, in general, because I can't speak, about someone
Right.
well like that, but I'll just say rheumatoid arthritis symptoms in general. What we have found at our clinic in Mexico is that most rheumatoid arthritis symptoms are caused by an infection. The most common infection that can induce that would be a zoonotic infection, something like the Borrelia species. I've seen it caused by the Treponema denticola family. Mm-hmm. I've seen it caused by Babesia, which is a very common condition, but very rarely does anybody ever test for it. And if they do, the test is pretty bad, so they miss it. It's also known as American malaria. There was a study done by one of the labs a number of years ago in California where they drew synovial fluid off the joints of RA patients. Mm. Or they were RA patients. They were patients who had arthritic joints. Mm-hmm. And the majority of them had mycoplasma in the joint. They did not test for Babesia in that study, but there's lots of clinical literature, of doctors who've treated rheumatoid arthritis. In fact, JFK's rheumatologist, our President JFK, he routinely treated all arthritic conditions with doxycycline for 3 to 6 months and had an astounding success, which tells you it must be an infection. Now, you can trigger rheumatoid arthritis in a lot of times just by eating something you're allergic to.
So is there?
So I would definitely have anybody with arthritic symptoms avoid the nightshade family of food, which is tomatoes, tomatillas, eggplant, white potatoes, paprika, and the pepper family, and see if the symptoms don't get much better within a week. We had a little internet study we did. It was just a volunteer take the nightshade challenge. And we had people that we just said, score how you feel joint pain wise, 1 through 10, 10 being the worst symptoms, and then stop eating nightshades for 2 weeks and then rescore yourself. And we had an American Airlines pilot that took the challenge. He emailed us back in 4 or 5 days and said, I can't believe this. I've been on prednisone, dexamethasone or something for 12 years, and 5 days after stopping the nightshades, he was symptom free. So food allergies, particularly of the nightshade family, because there's a really nasty alkaloid in that food group that is well known to cause arthralgias. Definitely want to stop eating that and just see if you feel better. But other than that, it is most always due to a zoonotic infection. And I've had people who had removed a root canal tooth and their rheumatoid arthritis symptoms went away within the day.
Wow, that's not surprising.
But I see a lot of people who come to us in Mexico with lymphoma, and their lymphoma came about because they were on immune suppressive drugs for their rheumatoid arthritis for 10 or 12 years. So they suppressed the immune system so they, had a life from the pain. So, but yet then the immune suppression led to a cancer. So I would, of course, full and fair disclosure, I am on the board of the lab, but the reason is because we literally put the team together that created that test because of this terribly great need to figure out what's causing people's illness. And if her physician will order a test kit, now it's not available yet. It should be available mid-May. So if they go to www.ks3labs.com, and you guys can put the link on your website.
Absolutely.
Beta testing right now, so it'll be out at mid-May or end of May.
Okay.
So the doctor can order a kit, and what I would recommend is we have in Mexico, we like to do this, is to actually draw synovial fluid from under the joint and send a specimen of that in along with a big toe stick and a venous draw, because some of the things like mycoplasma that can cause RA, they live in very cool areas. They love the synovial fluid because it's cold, relatively speaking. There's very poor blood supply there, not much immunity. So that's a good place to hang out and just act like sand between two pieces of wood, just grinding and grinding.
Wow.
So that would really be the best thing to do. But of course, in the meantime, stop eating nightshades. It'd be cool for anybody out there that has arthritic symptoms to take that challenge. Don't eat nightshades. Tomatoes, which includes tomatillas. No chili peppers, including jalapenos, poblanos, green chilies. None of that. No white potatoes. No paprika, no eggplant. And by the way, also, that's the tobacco family. So no tobacco, no nicotine at all for 2 weeks, and see if your arthritic symptoms resolve.
So now if someone wants to get one of those tests and they get their blood drawn from their local doctor, are they going to be able to explain all of the, like how you just talked about, how taking different samples from different parts of the body and synovial fluid from the joints?
Well, the lab can't actually tell them which tissues to assay. I'm just speaking here as a clinical consultant who does consult to doctors all over the country. I recommend not the lab. The lab can't recommend anything. They'll test any tissue you send. I mean, you can do a biopsy, you can do spinal fluid. But if somebody's got arthritic symptoms and they got joints getting chewed up, they should see if their doctor would be willing to draw synovial fluid off and make that one of several specimens. I like the big toe stick and a venous draw, and also a finger stick. So you got the best chances of, looking 4 different places. You're going to most likely find what the culprits are. So
how effective are the treatments for the people you've seen that are on those immune suppressing drugs that cause lymphomas and things?
The longer they've been on immune suppressive drugs, the more complicated the patient is, because then they create all these other pathologies, because prednisone wipes out your adrenal glands.
Right.
So it's very hard to restore the adrenal function, but in Mexico, we have special IVs we do that help rebuild the cell membranes and restore cell membrane electrical potentials. And then we use stem cells whenever it's indicated. Just try to rebuild their whole body, because if they've been on immune suppressive drugs for a long time, there's a lot of yeast in their body, because that's what steroids do, is you're just going to start growing yeast everywhere. And next thing you know, you can't sleep. If you don't sleep, your adrenal glands are shot because you never rest. And you don't recover. So, most of them are recoverable. I'd say probably 80 to 85% of them get back to fairly normal.
That is good news.
That's good news. Wow. Yeah, because I know that rheumatoid arthritis is a big thing these days, as is lots of other autoimmune diseases, fibromyalgia and everything else. And so it's good to know. I love what your website, hopewellnesscenter.com, there is hope for people.
There's always hope.
So ironically, we only have one lupus patient who has not become ANA negative. The marker for lupus is an anti-nuclear antibody, and we only have one patient in the last 13 or 14 years that has not gone ANA negative, and she's kind of whooping my butt. I'm from South America, and she's she screwed up our reputation. We used to say we had 100%, but trust me, I think about her all the time, and we'll eventually figure it out. But autoimmune diseases are they can be brought back to normal. And you just have to understand the physiology, the biochemistry, the immunology, the toxicology, the infections. These zoonotic infections they're everywhere, and they're historically terribly tested for, so nobody really knows they have them unless you hang out with a very Lyme literate doctor, and even then, they only test for 4 or 5.
Wow. Yeah, if you're missing half the things you're trying to test for, if you don't even know you're missing them, then I can see where there'd be an issue. But we got to take another break. We want to run another question after the break, so we'll do that. And then we have another written-in question for Steven Hines, and we'll be right back with Steven Hines after this break. If you're like me, chances are you've tried lots of different whey protein powders and different protein powders on the market. The 2 I like are Sun Warrior Protein and One World Whey. One is vegan and one is not, but One World Whey, I love it. It's 100% raw and grass-fed, coming from Amish farmers with healthy cows. It's an incredible product. It's got about 25 grams of protein with each scoop, which is really, really high. It increases the glutathione levels in your body. It helps helps to eliminate heavy metals and toxins out of your body, as well as radioactive fallout from chemtrails. And it helps to decrease inflammation in the intestines, which helps with having healthy bowel movements. It builds lean muscle, and it's great for your skin and anti-aging. It increases your energy levels. It's really, really a great product, and it's not just for building muscle. It has so many benefits, and you can learn more about all the benefits of this incredible product at extremehealthradio.com/whey, WHEY, and it's put together by Synergistic Nutrition, and One World Whey is the product name. I highly recommend checking it out. If you are interested in buying it, please consider doing it through us. We'll get a little commission, and you will see what I'm talking about. You're going to be hooked and addicted to this stuff. So consider this product as part of your daily protocol. Maybe put it in your smoothies, and just, it's really, really a great product. So thanks for listening, and let's get back to this interview. All right, we're having a great time with naturopath Steven Hines, master herbalist from San Angelo, Texas, doing great work with Lyme disease and all kinds of autoimmune diseases. And he really is an expert in digestion too. And we like to talk to him a little bit about digestion, because it seems like everybody in today's culture has issues with digestion and IBS and indigestion and all kinds of things like that. But before we get into that, I want to have one more question. This one's from Jenny, and let me go ahead and play this and cue it up here.
Oh, hi, Dr. Hines. My name is Jenny from San Diego, California, and I have a couple of questions I would love you to answer for me. I had massive amounts of chemotherapy and radiation about 18 years ago, and I'm wondering if that could possibly still be in my body. And the other question is, what would be the best brand of probiotics to take for digestive health? If you could answer those questions for me, that would be awesome. Thank you so much.
Okay, Steven, so what did you think about Jenny's question?
So, I have people ask me all the time about, I took chemo a year or two or three ago. How long does that stay in my body? Well, if you look at the half-lives of chemotherapy, most of them are half-lifing out in a couple of days. But the damage done by them, can go on for many, many years. And it's very difficult to say because everybody's different. But when somebody has some later subsequent problem since they had chemo, you say, well, is it because the chemo's still in my body? Or is it because the chemo so suppressed my immune system that now I have picked up ascaris worm in my gut, or a tapeworm, or a trichinella, or amoeba? Did it wipe out my stomach cells? I'm not making enough stomach acid to keep my stomach sterile. Mm-hmm. Everything we eat has got bugs and bacteria and parasitic cysts. So very unlikely that there's much chemo residue left, except if she took a platinum-containing drug like cisplatin. Those platinum levels can be high for I imagine for many, many years, because they'd almost have to be chelated out with some sort of a binding agent, whether pharmaceutical or natural. But more likely what's happening is that the immune system was suppressed because of the chemo, and the person's gastrointestinal barrier became breached. Therefore, they began to grow yeast and an overgrowth of pathogenic bacteria or parasites. And so, like if you went to New Orleans a year after the hurricane, you had a whole different set of problems. The day after the hurricane, people were drowning. Mm-hmm. A year after it, they're dying of cholera, yellow fever, West Nile virus, and dysentery. So what starts the problem and what perpetuates the problem is two different things usually. So most likely she's dealing with something that occurred due to the immune suppression from the chemotherapy. And, this, why does someone have lymphoma to begin with?
Right.
Well, it's very well proven in the literature. If you go on PubMed, PubMed.com, type in lymphoma/Lyme disease, lymphoma/Borrelia, and you will find T-cell lymphomas, B-cell lymphomas. We saw a guy in Mexico that had mantle cell lymphoma, who was a classic case, as we were talking earlier. 12 years of prednisone, methotrexate for treating the symptoms of rheumatoid arthritis, when in fact, when he ran a spirostat test, which is now the KS3 diagnostic lab test, he had 2 or 3 different spirochetes. He had babesia, he had cat scratch fever, he had Ehrlichia. The infections, what was causing his rheumatoid arthritis symptoms. And then the immune suppression treatment then triggered the lymphoma. So more than likely, she still has the original infection or whatever circumstances brought about the lymphoma. Maybe it's benzene or toluene or hexene, some pesticide residues, root canal teeth. Rarely do I ever see people with cancer that don't have infected dental work.
Yeah, the dental work, most people don't realize this, but it is becoming more popular, and people are starting to wake up to this whole world of dental health and how dental health affects disease. But that is really a huge part of the equation, isn't it?
Very big. I mean, I've seen people get out of wheelchairs after having 3 or 4 root canal teeth pulled. I've had 30 or 40, I lost track of the number of people who had irretractable diabetes, who yet had perfect diet, good supplementation, were doing everything right, yet their blood sugar was 400. Sent them to a dentist to be evaluated. The dentist pulled a couple of root canal teeth, and their blood sugar dropped 200 points in 2 days.
Wow.
See it all the time.
Yeah.
And, it doesn't preach well to the dental world out there because they're taught that root canals are fine. But the actual scientific data where they've pulled root canal teeth, crushed them into powder, tested the toxicology, it's so insanely toxic that you're just asking for trouble. I mean, there's really well done root canals, and then there's awful root canals. But one study of 1,800 and some odd teeth extracted and tested for toxicology, all but one of them had endotoxins that were so insanely toxic that they literally inhibited every enzyme that they exposed them to that's common in the human body. That's
amazing. We heard a doctor, what is his name, Bob Dowling, and I think he's somewhere in South America, and he's going so far as to say that all cancer is caused by root canal. I mean, it's kind of hard to say, a definitive answer like that, but he's really on the same page as you are in terms of
sure.
Yeah.
There's an incredible association, and some cancers, no doubt, absolutely are caused by root canal teeth, because we've actually done infrared scans like thermography. Do a head shot along with a breast shot, and you can see the right and left mammary meridian, which is an incisor or canine tooth on the bottom jaw, lit up like a Christmas tree, and a white line right down to their triple negative breast cancers. And since we've studied it, the 5 triple negative breast cancers I've seen in the last 6 years, all of them had a root canal tooth or an extraction on that tooth and an infected socket in that locale.
Oh my gosh.
Are there any dental offices or dentists that you might point people to, or websites in terms of people listening to this?
That's called the IAOMT.org, which stands for International Association of Oral Medicine and Toxicology. So .org, IAOMT.org, and that's a group of dentists who are specially trained, who've gone much further than standard training to learn about toxicology and immunology and the problems that can occur by mixing mercury in your mouth with a nickel cap.
Wow.
and creating a battery, and it can cause neurological symptoms. And what if you put metal across the midline and you screw up your acupuncture meridians? And what kind of toxins are in a root canal tooth or in a socket? I have a dentist friend that I referred people to, and we've seen pushing 25 or 26 Parkinson's patients whose Parkinson's symptoms totally resolved.
Oh my gosh.
Up their dental issues, whether it be mostly their upper left and upper right wisdom teeth sockets, where they had their wisdom teeth removed maybe 20 or 30 years ago. But those sockets, about 94% of the time, have an infection in the socket. And if it's in the upper left or right, it's so close to the trigeminal nerve that crosses over the jaw there around the first and second molar, I believe. The endotoxins just get pushed out of there under pressure, and they get picked up by that nerve, takes it up into the brain, and they have tremors and shaking. And
that's what's caused by, that's what they call the cavitations, is that right?
Cavitation, and in Japanese scientific literature, it's called a Nico body.
Okay.
But no doubt, it's the science is there. It's irrefutable. Now, there may be those who do not want to hear it, because maybe they're in the dentistry profession and they don't want to believe that they've maybe been injuring people. But you're ignorant to a point. But if you listen to a program like this 3 or 4 times, and you're a dentist and you hear somebody say these things are dangerous, you are culpable. If you listen enough and you don't go and do your research, go to an IAOM meeting and get exposed to the truth, there's a point where you can no longer claim ignorance.
Right, right. So, Doctor, I wanted to get also, there was one other written email question, but I wanted to get to the second half of this question. And I also wanted to talk at the very end, if you have time. I know we're kind of running against the clock, but I wanted to give people some ideas to improve their digestion at the very end, if that's something you have time for. But the last part of this question was about a digestive probiotic.
Well, it's almost an unanswerable question, because we'll do a show sometime on the microbiome I've been working on for a couple of years, is the diversity of flora in the human gut. I call it the missing organ, because the microbiome in the gut literally performs half of your liver function. And you should have 300 different species, and each species have many subspecies, and each of them is a little biochemical factory. And if when we start out in life with, we get our first inoculation through mom's vaginal fluids, which equate to mom's bowel flora. Ironically, vaginal flora equates to bowel flora. Then that's the first inoculation. We get mom's friendly bugs. Then breastfeeding, then you get some bacteria off the nipple, and then hopefully you ate some dog poop and cat poop and played in the sandbox and ate dirt, and you develop species but then, so you've got a diverse chemical factory. And then one day you take some antibiotic and you wipe out 100 strains. And so now all that territory that was taken up by that 100 strains is suddenly empty. So the 200 strains that are left take over that ground, and they grow to a greater level. And then 10 years later, you take some Cipro or Levaquin or something, you wipe out another 50 colonies. Well, then what bugs did not succumb to that antibiotic, they continue to overgrow. And so what you end up with is an ever-decreasing diversity, but ever-increasing amounts of the fewer and fewer bacteria. So we create all this autoimmune type reactions because our chemical factory is now lost diversity, and we're overproducing some chemicals and underproducing others. So, if somebody just took a round of antibiotics, my preference is something like HLC by Pharmax, because it is a human strain, And I use the foil packets, the big sachets, because you need heroic quantities to quickly tie up those empty epithelial binding sites before yeast begin to overgrow. But really the ultimate answer is you need to eat lots of ferments like kefir and yogurts and fermented vegetables, and rotate every fermented vegetable culture you can find. You want your fermented vinegars, your kimchi, your cabbages, like what do you call the cabbage stuff in Germany?
Sauerkraut.
Sauerkraut, yeah, the real stuff though. I mean, you need to make it yourself, or get Bubby's brand, Bubbies. That's actually really living lactic acid ferments. So initially, after an antibiotic, you want to get some HLC foil packets. Take a couple of weeks, a foil packet at bedtime. But after that, go back to diversity. Just always add some friendly bacteria into your diet, and avoid antibiotics whenever possible.
I hear you. Okay, so that's good. And we have a written question here, an email from Stella from New York, and she wants to know, let's see here, what is his number one tip for healing digestive health? Actually, this will be good to kind of do the digestive health at the end. What is his number one tip for healing digestive health, and his thoughts on coconut oil? I've been taking it in the morning, and it seems to help me a lot. Also, a second question, if you have time, what are some causes of a bleeding nose? My dad wakes up in the morning, and he sometimes gets a bleeding nose. Any thoughts on what it could be? And whenever I have olive oil, it seems to give me acne. Is that because my body cannot tolerate olive oil very well? Thanks so much, Stella from New York. So let's tackle the
questions.
Yeah, quite a lot here. Let's tackle the digestive health and the coconut oil, perhaps.
Well, coconut oil is wonderful because it has a medium-chain triglyceride that is antifungal and antiviral. It's also preferential liver fuel. So, it helps the liver make more energy. I think everybody, unless you have an allergy to coconut, should take coconut oil. It's wonderful. Coconut milk also. First, I actually have a series, a 4.5-hour DVD on gastrointestinal function and dysfunction.
Yeah, I was looking at that. That looks like what I would need to watch.
Yeah, it looks amazing.
Yeah.
Goes step by step through the whole GI tract. From a physiology standpoint, it was taught to a group of nursing students and laymen. It's really a very large story and difficult to just hit and miss. But, we do a stomach acid test. We have people taking betaine hydrochloride and adding a little bit each meal to see up until when they feel warm, and then we have them back down one pill, and that's the amount they're supposed to take to make up for their lack of stomach acid. It's called the betaine titration, but it all depends. If somebody has an existing stomach ulcer, then you don't want to do that because you're going to burn immediately. And so we like to have people take mastic gum, about 1,500 milligrams twice a day on an empty stomach, and about 3,000 milligrams of L-glutamine twice a day, empty stomach. You can do them at the same time, because that helps to heal up the gastric mucosa, and the mastic gum actually is anti H. pylori. It's antibacterial, so you can heal up a bleeding ulcer usually in 7 to 10 days with that. So we always have them try that first before they start adding supplemental stomach acid, or some people like to add apple cider vinegar with their meal to compensate for the lack of stomach acid. It's a very, very large subject.
Right.
And
Yeah.
I don't want to get people chasing down the wrong animal. Best thing is they just get the 4.5-hour DVD and watch it step by step and understand all the things that can happen, and consult with their physicians regarding maybe an ultrasound of the gallbladder, see if there's stones or sludge. I consult all day long to doctors on behalf of their patients around the country, and doctors are trying to learn an integrative approach but don't really know how to do it very well yet. So they all get the DVD and watch it because it was designed to educate laymen and doctors, and it really has to be done in stepwise fashion, or you're going to end up getting the cart in front of the horse.
I hear you. Yeah, the digestive tract is so complex, and for you to spend 4.5 hours in a lecture on that, I think it's well worth it too.
I do too. To
really get that, because digestion is really everything, isn't it?
It is everything, and I need to redo it because it would be a 20-hour lecture now. But it's you know, the body can't stand that much information at once. It's going to cover most of the bases. You guys could actually just order them and have them available out of your California office, and we can supply those. So
awesome.
That's the first place to start, because we got to talk about probiotics, and we talk about gallbladder, liver flush, we talk about digestive enzymes and stomach acid and reflux and irritable bowel and ulcerative colitis, and what tests for doctors to run to help their patients narrow down the possibilities.
Right. Yeah, there's so many factors, especially in digestive health.
Diet. We have a book, it's called The Road to Health.
Mm-hmm.
That's the book Laura Schroeder wrote, and I as a co-author. It's a no-grain diet, no disaccharides for at least 3 months. It's a perfect diet for most people to heal their gut, to stop the inflammatory process. And most people, I don't care what's wrong with them, within a month, at least 75% of them have some palpable improvement just by being on our diet.
And just by getting off grains, isn't it?
Yeah, in the disaccharides, once you degenerate the villi, you have lost the ability to digest any starch, and all your carbohydrates, all your corn, wheat, barley, oats, rye, potatoes, they all break down into double bond sugars. Well, if you can't split those double bond sugars into monosaccharides, you can't absorb them into the bloodstream. Therefore, you start going hypoglycemic, which then drains your adrenal glands, because your body has to pump out adrenaline and cortisol to stimulate the liver to convert glycogen back into glucose to save your life every 20 or 30 minutes maybe each day. And that's really the number one cause of adrenal exhaustion.
Yeah. It's... I'm sorry, are you still there?
Yes.
Yeah. So the digestive health really is kind of the root, and then it kind of cascades and causes adrenal issues and causes all kinds of foreign proteins to be entering the bloodstream. So now you got autoimmune problems, and every organ has to compensate for that, right? And it just goes on and on as far as all the cascading events that happen as a result of not digesting your food.
Absolutely correct. And even 90% of hormone problems are simply the result of an inflamed gastrointestinal tract.
Wow. Well, I know that you're on the run and you have lots of people that you're seeing there. You have lots of cancer patients at the moment. Any thoughts on this bleeding nose, the question that she had?
Well, anybody with a bleeding nose, you know, if it's seasonal or not. If it's seasonal, then obviously allergies play a role. Anytime anybody's got nosebleeds, I would tell their physician to really watch their blood pressure close, because if you have high blood pressure and weak capillaries, which is generally due to poor diet, you know, if you have a low level of flavonoid intake, so the vitamin C family, grapeseed extract also, not grapefruit seed, but grape seed extract. Copper is important. I would get a copper-zinc ratio. Never take copper or zinc one without the other without assessing it, because you will cause an imbalance. But they need the bioflavonoids, that vitamin C family, to strengthen up the capillaries. But always make sure that there's not hypertension going on, because excessive blood pressure can make capillaries weep and bleed. And also have their doctor check their platelets. Make sure the platelets are high. because there may be some underlying issue hematologically, like in IPT, TP, idiopathic thrombocytopenia purpura, which simply means an autoimmune type problem where the spleen starts eating your platelets, which I'll tell you 80% of the time is caused by a systemic H. pylori bacteria infection. A lot of people end up getting their spleen taken out because their platelets are going down. Well, if their doctor knew to test them for antibodies against H. pylori bacteria, and if it was elevated, to treat them even in conventional fashion with a triple therapy, that most of the time goes away. So obviously you want to check platelets and make sure that there's not a bleeding problem. And there's always the rarity of having a what we call a coagulopathy, factor 4, factor 5, factor 8, 10, 12. There's numerous ones. Some of them are bleeding disorders. And also it can mean that there's a liver problem. Maybe they're not producing platelets, or the liver has eaten them up, or there's some, they've depleted the coagulation pool in the liver. So, if that goes on a long time, you're sure you want to go to a doctor and say, we need to pay attention to this. This may be something serious.
Yeah, as you can tell, it's pretty complex, and maybe all of this stuff is really kind of there as a result of something bigger that's happening, and the person may need to really look and see, is this a sign of something else, and that happens with people a lot. And so, Doc, I know that you're running out the door and you got a lot of stuff to do. So you're working on a new book, right, on Lyme disease, and are you going to be doing any other projects? Got any other books? And you mentioned an ebook.
Working on the definitive guide to Lyme disease diagnosis, treatment, and management. I'm also working on the equivalent on fibromyalgia. I'm also working on turning that DVD series into a book on the gastrointestinal function and dysfunction, because really the other things are kind of predicated on fixing the gut. It comes to Mexico and they're just, so chronically fatigued and in pain because they're, quote, Lyme disease. Well, we all start with the gut. Clean up the gut, get their hormones fixed, because even if they do have Lyme disease, you got to kind of get them stabilized, because when you start treating their Lyme, then they end up feeling worse for a while. So the gut's everything. So the gastrointestinal dysfunction will be another book. And then probably going to do something with the Alzheimer's, dementia, neurological conditions. I'm by no means a neurologist, but it's kind of ironic that a traditional naturopath, now I've got a medical doctor partner, but we have a higher success on neurological conditions than any neurologist, which is kind of ironic. I mean, they're great at diagnosing, whether something is neurological, where once they're diagnosed, they say, well, they got dementia or Alzheimer's. Well, then we take it over there and find out really what's causing their neurological problem, rather than just focusing on a label that's been attached. And like with Alzheimer's, we know that certain people don't methylate well. They become depleted of B12 vitamin. Chlamydia pneumoniae in the brain of 20 to 25% of those people, according to the British Journal of Medicine, probably 10 years ago. And then you got heavy metals. You've got thyroid dysfunction. You've got insulin resistance in the brain. 40% of them, it's diabetes of the brain. So you put them on a high coconut oil diet and, basically a hunter-gatherer diet, and they improve. And then among with that, 85% of them got spirochetes in their brain. So it's a multifactorial thing. And, the neurologists do what they do, which is great, diagnostically, but they're not really trained so well in what really causes those symptoms. And that's where we come in, because we're not neurologists. We're fix-it guys, we just say, okay, now the engine's bad, we need to rebuild it, you know.
Nice. And so people can visit Hope Wellness Center and get a lot of information about your rates and different things they should consider, and kind of visit your whole center there in Mexico.
Yes, hopewellnesscenter.com is the Mexico site, and there's resources there. We're going to be remodeling that site. It's kind of antiqued. Hopewellness.com is domestic. We have different things on different sites, and we're fixing to rebuild them both. But if somebody is interested in doing the KS3 diagnostic test, which is that big zoonotic panel, they can go right now to Spirostat, SPIROSTAT.com, and just that's eventually going to become KS3labs.com.
Okay.
People know on there when the new test is available. Hopefully mid-May to the end of May will be open to the general public, and they can always just leave an email address. Please let me know when this is available. And
wow, this is you've got a lot of things in the works here, lots of books, and working with people. This is great. I bet you love it.
I love it. I do. I don't like the politics, but you got to deal with politics anywhere. We're some guarding their turf.
Yeah, there's always going to be that going on, right?
Yeah. So I work around it.
And that's why you have 2 locations, I would imagine, right?
That's what?
That's why you have 2 locations, I would imagine, right? One in Mexico and...
Yeah, because what we do in Mexico is under the auspices of 2 medical doctors, and basically although I'm half owner of the clinic, I function as a clinical consultant to the medical doctor. I'm the strategist, I'm the FBI guy, you know. I look at all the evidence and make my recommendations as to what is the best course of treatment. And, you know, we're always basically trying to find out why. Why did you get lupus? Why did you get fibromyalgia? What's the infection? Is it a fungus? A lot of times cancer is not actually cancer. You can have a tumor mass that's strictly because you have a fungal infection. It may be mycoplasma. We had a patient that came through 3 months ago that died of liver failure that was diagnosed as liver cancer, and it was not. He had a raging, out of control cat scratch fever, which is a real infection. That's what it's not just a Ted Nugent song. Bacilli, and every cell in his body, when we saw it in the microscope, was loaded with them, and they're known to cause granulomatous masses. And the oncologist missed it, his family practice doc missed it, a dermatologist missed the bullseye rash on the guy's back for 7 months. It was still there when he died of what they thought was cancer, and they chemotherapied him because they thought he had cancer, and he didn't.
Wow. So there's a fungal component to this, and I know that you're familiar with Dr. Simoncini, I think. And
yes, I know Dr. Simoncini. Met him a number of years ago, just once. We had dinner together and talk about fungus masquerading as tumors. And that would be a whole other great show, because it's kind of hard to imagine that that's possible, that a pathologist could miss that. But it happens every day, all day long. And the 3 pathologists that I've talked to about it weren't even aware of it until I brought it up and explained and figured out really why it happens. I mean, they just never even, no one ever asked them to stain for fungus. They just say, stain it for cancer, and say yes or no, it's cancerous or not.
Right.
Surgeon standing by waiting. Well, if they come back with cancer, then they just stop the process. They never are asked to go ahead and stain with a different stain to see if there's fungus, because there's no presence of mind to do so. But it's a great tragedy. Many people are treated for cancer more than a fungal mass.
Wow, that's just amazing. Dr. Hines, thank you so much for being on the show and sharing your work with us at hopewellnesscenter.com. And You know what? It would be amazing to do other shows where we could really dive in and just pick one subject and just dive in as deep as you'd like, because I have 1,000 questions for you. So if you're ever interested in doing that, we would love to do that.
I'm happy to help.
Awesome. Thank you so much, Doctor, for being on the show.
You're welcome.
Wow. So we just had a great conversation with Steven Hines off the air. And what an amazing guy he is. He turned us on to some different things that we'll link to in the show page, that even though we didn't talk about him during the show, I feel like I should put some links up on the on this show page for you guys. And I hope you enjoyed that interview, and go over and visit his website, hopewellnesscenter.com, and Hope Wellness. And you heard at the beginning of the show where I was talking about some of the different issues that he deals with, like autoimmune diseases and cancers and fibromyalgia. And he's just a cutting edge guy. And if you go onto his website, hopewellnesscenter.com, you'll see that he does all kinds of different treatments, like massages and electromagnetic magnetism and oxygen and hypercellular respiration therapy, sodium bicarbonate, chelation, herbal therapy, enzyme therapy, nutritional therapies. And it's just amazing the amount of cutting edge work that he's doing, Steven Hines, in San Angelo, Texas. So I personally think that he is one of the leaders in alternative health, and he's on the cutting edge of being able to get on top of these kind of diseases that, you know, maybe you're dealing with certain things that you think there's no cure for, but there are cures out there, and it's just amazing. So anyway, we're so happy to have Steven Hines on our show, and I hope you enjoyed it. And I just hope that everything is going well for you. If there's anything that we could ever do for you, Kate or myself, please email us, Justin at extremehealthradio.com, or Kate, Kate, at extremehealthradio.com, and we'd love to help you out. And I also want to let you know that we have a great store with lots of products that we're affiliated to on our website. So check out our store. And if you'd like to donate, we're 100% listener supported, and we could really, really use your donations. Recently, we've been putting a little bit of money back into equipment and software to make better quality shows for you guys. So that's something we're striving to do. And so I want to thank you to have donated recently. We really, really appreciate it. I can't tell you how much we appreciate that. So thank you so much. I want to thank Mike Adams of naturalnewsradio.com for having us on his network. Thank you, Mike, for that. And that's about it. If you would do me a favor, I would really appreciate this. This would be a great way to support us without donating or buying anything. If you could go to extremehealthradio.com/love, LOVE, and click a button on that page. It'll just be a real simple thing, and you can just click a button, and that will help support our work. And it will take you 2 seconds. If you could do